Okay, so today we're going to be talking about MCL sprain in the subacute stage of an injury.
So with the knee, obviously range of motion is very important, and the knee really only has two things that it does, which is flexion and extension. And so one of the biggest things you can do to improve that early on in an injury is just do light ankle weights, even within like a week or two of the injury. So just with the exercise, what you can do is just lay prone with a light ankle weight on the injured leg, and then just do curls as far as you can, which is just like to the comfort zone, and then gradually you'll be able to get further bend out of it. And then same thing with extension, just while sitting in a chair. You could do it laying down too, but it's better if you just sit down. Just have the weight again on the injured knee and just extend it out as far as comfortable. Just do 3 sets of 10, but obviously focus on the eccentric contraction as well as the concentric, because eccentric, it's important. Return full range of motion. The goal obviously of the exercise is to return full range of motion of the injured knee. And obviously you don't want to have any pain with it as well when the therapy's over. Plan of care is just increase gradually as range of motion improves. That's kind of the whole point. And just daily, just like try and increase the range of motion day by day. That's kind of the whole goal until you're able to have full bend and perform your daily living activities without any issues. So the rationale of exercise is you want to increase the ligament elasticity and make it more pliable. If you didn't do any exercises and just let the knee sit, it would just decay and degrade, and the ligaments would become really tight and just thick, and you wouldn't really be able to do much at all with your knee. And then just progression of exercise, work up to be able to achieve the degrees listed below. And these are just the degrees that are normal for everyday things, any kind of daily activity that people will be doing on a daily basis. Next slide.
So when talking about flexibility and stretching for the knee, as Rennie mentioned before, one of the main things that the knee does is flexion and extension. And so one thing that we wanted to do is for the exercises have active assistive knee slides, where you'll be on a table, and whatever knee is currently injured, you would slide it back and forth, really trying to work on getting that flexibility back in the injured knee, with the assist of your foot on there. And you do 3 sets of 10 of that. The goal of this is obviously to regain flexion and extension, and full range of motion. With that, we have autogenic inhibition, which is basically a protective mechanism, which prevents the muscles from exerting more force on the bones and tendons that it can tolerate. So it's important that we build that autogenic inhibition back. So that way when the athlete or whoever is injured, when they go back to their sport, they're able to stretch to the length that they can do, and then they're more flexible, which decreases the risk of being injured again. We also want to work on that reciprocal inhibition as well, which is basically the process of muscles on one side of the joint relaxing, accommodating for the contraction on the other side. It's important to do that. And then for the rationale of the exercise, we obviously want to improve neuromuscular control, which as a result will also increase balance, which will help the athlete or whoever is injured in their sport and in life as well. And when we progress the exercise, we obviously would take the foot away. We could possibly add some weight to the ankle, just depending on where they are pain-wise and where they are with their flexion, extension, and range of motion. Next slide.
Okay, for strengthening and control, we want to be able to basically just keep the muscles strong. We don't want to lose that strength. So for exercise, we got static, quadriceps contractions. You can hold that for 10 seconds and rest for 3 seconds, maybe like 10 to 20 reps to try to keep the quads, basically the strength to stay and not lose that strength. So the goal would just be reduced neural inhibition. The plan of care, you will be able to create that active range of motion. It'll help you regain that motion of using the knee. The rationale of the exercise will be to maintain elasticity and contractility, to help stimulate that bone integrity, to keep the bone strong, to stimulate the muscle fibers, to be able to keep that strength as well. And then progression of exercise, the static quadriceps, you could do static quadriceps with a towel or foam underneath to kind of make it a little bit more challenging and to create that height on it. So it could be just basically more challenging. That's it.
So neuromuscular control, this is a really important one. I wanted to start out with doing sitting with the bat board. As you see in the image right there, she has both feet on there. And what the patient would do is they'd rock their feet back and forth, side to side. They can eventually work on doing a full circle, but I wanted to start out like see how they feel and go from there. You do 3 sets of 10 of that. With this, it will obviously improve dynamic stability, which is really important. And the plan of care is like working on feed forward and feed back, making sure we program that muscle activity so that way whenever it comes time to get back to their sport or daily living, they have the muscle activity, they have it programmed in their mind that their muscles can do that, they're aware of it, they're used to it, they've seen it before, it's not anything new. Really work on strengthening that up so that way we can prevent injury. Once again, rationale, obviously we're going to improve proprioception, kinesthesia, and balance training. It's really important when it comes to neuromuscular control that we work on all of those, increasing all of those and improving all of those after an injury will also help in the long run with preventing it. When we go to progression, we can start by standing up on the bat board, still both feet on there, holding onto a chair or a wall, anything that supports balance, and just working on doing front and back, side to side, and then possibly like full circle, really working on improving that dynamic stability. Next slide.
So going off of that, we'll be going into balance. The exercise that we picked would be standing on the one leg once the athlete is able to put weight on the injured leg. And we'd be having them stand near a wall or a chair to help keep balanced if they start losing it. And we would do 3 sets of 30 seconds for that. And the goal of this exercise would be to regain their center of gravity and their coordination back in their muscles, since when you have an injury, you lose your center of gravity. And then for plan of care, we'll be working on the muscle and joint stability in that injured area, since all of that is weakened. And then for rationale, we'd be improving the proprioception and kinesthesia of the athlete, since all of that has been thrown off. And then with progression of exercise, we would have them move from just standing on a stable flat surface to either a foam mat, a trampoline, anything that'll give them a little more challenging setting for that balance. And we would also still have them standing near a wall or a chair just in case they need to stable themselves. And we would be using or doing that 3 sets of 30 seconds or more, depending on how the athlete can take it.
So for open and versus closed kinetic chain exercise, I chose closed kinetic because it's lower body, and you need to have some weight bearing stuff for lower body typically. So the exercise I chose mini squats, 2 sets. You could just use a chair to help you to make sure you're not, going too low and then you can have pain or whatever. So that would just help aid you. And then for the goal, it will just increase your joint stability. The plan of care, this exercise will help you target multiple muscle groups, which is very beneficial with an injury like this. And the rationale, it will just stimulate your proprioceptors, decrease your shear force in that joint, and then increase joint congruency and stability. And for the progression, you could do like mini side squats. So just basically the same thing, but just moving towards the side as you do the squat to help with that, to help with the stability and the joint strengthening.
So functional activities, kind of like what I said on range of motion, just daily activities. I could have picked something easy like walking, but even with like injuries, it's still not super hard to walk. So I went with something a little more, I guess, challenging, and that would be going up and down stairs. So the goal is pretty straightforward, just to return to living activities without injury, slowing life down. Plan of care, just I mean, it's pretty straightforward. Just perform daily tasks without injury being an inhibiting factor. The rationale would be to return flexion extension of the knee to its proper degrees of motion, like on range of motion, and eliminate any discomfort with walking or climbing up and down stairs. For exercise, the progression, you can, I guess, begin with just your good leg would be like supporting you on the floor. You can have like a little like foam step in front of you, and you can just raise and lower yourself off of that foam step with your injured knee. And you could just slowly progress to going up real stairs and eventually climbing flights of stairs, or maybe even skipping a step or two and putting more stress on the knee, eventually not having any issues with going up and down stairs.